Hello everyone and welcome back to my channel. Hope your preparation regarding the Neet MDS 2022 exam is going on very well. Check out all the image-based question videos on my channel. If you still didn't found and didn't check those videos, then please check all those videos in the playlist of Neet MDS on my channel. Along with that, as you know that already the Neet MDS 2021 paper discussion is going on. Already the two videos are out regarding the Neet MDS 2021 paper. First one is the image based question and second one is the part 1 of the question discussion. Now today also I come with another part of the discussion of the Neet MDS 2021 paper. So without wasting time, let's get started with the paper. You can see the question on your screen. The child patient has a history of trauma and complains of deviation of mandible to the right side. Clinical examination shows a growing button-shaped swelling in front of his right ear, which was present since the past 2 years. What is the most likely diagnosis? Option A, right unilateral ankylosis. Option B, left unilateral ankylosis. Option C, bilateral ankylosis. Or option D, hyperplasia of condyle. So what do you think what will be the right answer for this question? The right answer is option A, that is the right unilateral ankylosis. To understand this question and the answer, that why the answer is the option A, you need to read and understand the chapter TMJ disorders, and from that you have to revise the important topic of TMJ ankylosis. Talk about the clinical feature in the TMJ ankylosis. Basically it depends upon the three things. One is the A, second is T, and third one is the S. A is the age, whether the person is an adult or a child. Second is the type of ankylosis, whether it is fibrous ankylosis or the bony ankylosis. And third one is the involvement, whether it is unilateral involvement, that is on the one side, or bilateral involvement. Bi means two. That means on both the side there is the TMJ ankylosis. So depending upon this, we have classified the TMJ ankylosis and the clinical feature of the unilateral ankylosis. In case of unilateral ankylosis of TMJ, there is the deviation towards the side of the ankylosis. That means wherever the ankylosis is present, our mandible deviate to that side. For example, this is my left side, and if I have the TMJ ankylosis to my left side, then the deviation of my chin is towards the left side. Fine. The second feature is, in case of unilateral TMJ ankylosis, there will be the fullness on the side of the deviation, and on the other hand, on the normal side there is the flatness on the normal side. The patient clinically regarding the unilateral TMJ ankylosis. Now come to the bilateral TMJ ankylosis. Bilateral TMJ ankylosis, there is no deviation as such, but in children's there are few features which are clinically very prominent and very important. The first one is the bird face. This is the key feature, that in case of children and in case of bilateral TMJ ankylosis, the bird face is seen. Second one is the Andy gums is there. Third one is the excessive marked micrognathia is there. That means excessive marked reduced mandible is there. So marked micrognathia is there, बहुत छोटा हो जाएगा mandible, so that is present. And the one is the Vogel Jessett, that is the marked and the excessive maxillary portion in the vertical direction which appear as a bird beak, as you can see in the picture on your screen. So that is the fourth clinical feature. It is written that on the right hand side only, that means it is case of the unilateral. Second, there is the swelling or a button shaped swelling is there. That means right hand side का case है, unilateral case है. It is the right hand side case of ankylosis and it is the case of unilateral. And the one more clinical feature we have read just now, that in case of unilateral TMJ ankylosis, there is the swelling or the fullness. Cheek fullness is there. Fine. So that's why in this question the right answer is option A. Now begin with the next question similar to this topic is, unilateral TMJ ankylosis is associated with the following features except. Remember that whenever you read the question, you read the word except or the word not. Now let's see the options on your screen. The first option is the multiple carious teeth. Second one is the facial asymmetry with the fullness on the normal side of the mandible. Second is chin deviated towards the affected side. And fourth one is the prominent antigonial notch on the affected side. So what do you think? What will be the right answer for this question? I think this is very easy for everyone now, as we have understood the clinical feature of the TMJ ankylosis. Here the right answer is option B, that is there is not the prominent fullness on the normal side. It is present on the affected side. So this is the feature which is not associated with the TMJ ankylosis of the unilateral case, as in the second option it is written as the prominent fullness is present on the normal side, which is not the feature of TMJ ankylosis, which I have already told you. That's all about the today's discussion regarding the Neet MDS 2021 paper with complete explanation. Along with that, you can also check out the video regarding the classification of the TMJ ankylosis, which is very important. I will definitely put the link of this video in the description box of this video. Along with that, now today onwards we have to read the oral surgery and about the LA or the nerve block, as a lot of queries there regarding the nerve blocks in LA. So in my upcoming videos of this month, definitely we will cover that part too. So stay tuned with that. That's all about the today's video. Hope you like this video, and if you like this video, hit the like button. Along with that, in return, I just want a small effort to share my videos and to subscribe to my channel if you are new on my channel. And don't forget to press the bell icon. The importance of bell icon is that you can have the notification of my upcoming videos. Still have any query, you can drop me the mail which is shown on your screen. You can also follow me on my Instagram with my Instagram ID shown on your screen. Along with that, you can have the PDFs of the past paper with solutions in the form of PDF, which will be delivered on your WhatsApp. So you can contact me by any of the mode. Thank you for watching and all the very best for your preparation.